Hello everyone, am I audible? So welcome to this webinar, and before we start up this session, let me welcome our co-panelist, Dr. Chaitanya Bhandare. He is one of the, excuse me, just let me open up my screen completely. Yep. Just give me a little time so that, okay. Yeah, thank you. Okay. Yes, thank you. Now, so Dr. Chaitanya Bhandare, he is actually a secretary for this Chamber of Commerce and Industry in Tokyo. He coordinates from the coordinates in between Indian and Japanese Chamber of Commerce delegates. The Chamber of Commerce is nothing but all the business high-end kind of HNI business individuals and the politicians. He used to coordinate amongst this delegates from India to the Japan and from Japan side to India. So whoever they go with the delegation to Japan or any delegation come from the Japan to India, he is the one who coordinates in between, and he is secretary for that Kyoto Chamber of Commerce and Industries. And we are thankful that on the last minute, when I just called him, like in the conversation only, I confirmed him, like, please join with us in this one of the interesting entrepreneur kind of a session. Our doctor community also wants to join this kind of a business initiative. So for that, I requested him for this, for his presence in this webinar. So he accepted it, and thank you very much for Dr. Chaitanya. And
You're
he
welcome.
one of
My
the
pleasure.
thinking chord between if anything happens, if you go something beyond the Indian level, he will be the one who is an actually resource person for us. Please.
Thank you very much, Dr. Anil. It's an honor and also a pleasure seeing you after almost like 8, 9 months. Uh, yeah, I'll be here. So I will listen to the presentations and maybe by the end, if I mean, I might give some inputs from my side. And also like I'm more here to listen to your talks. And thank you very much for your invitation.
Thank you very much for your precious time. And let me also introduce my second co-panelist, Dr. Veerabhadra Rao, one of our very cute speaker of Cosmo Dental Academy and one of the best academician, the best speaker, and he's our one of the lovely principal for our dental college. Excuse me, just a little hiccup is there for the presentation. ये नीचे नहीं जा रहा है. Just got it. Thank you. So he is the one from the academic side. If anything is there, he will give us guidance regarding any kind of an academy related or service that speaker related services. He is there with us for all the time, and he's one of the franchisee partner for Cosmo Dental also, and he's one of the most eminent speaker for Cosmo Dental Academy also. Thank you, Dr. Vadrarao, for giving this valuable time.
Good morning, good afternoon, everybody. A very warm welcome from my side also to all the entrepreneurs, the fresh entrepreneurs who want to become entrepreneurs. So let us not waste much of the time and then go ahead with the presentation. Once the presentation is done, like we have ample time for us to discuss whatever has been told to us and whatever has been presented in front of us. Anil, he's a guy like to approach whenever we get stuck business oriented, whatever wherever it is. He gives us a lot of solutions, not only to the to me personally, also not only to the family, to the institute also. From my side, I very warmly welcome Dr. Anil. So let us start the presentation. Once it gets over, then we'll get back to the discussion. Thank you, Anil, for making me one of the panelists. I'm really honored to be here.
It's our pleasure, sir. Thank you for your time.
Thank you.
Now, let's coming to the topic now. When we started with this webinar kind of a session, when I heard Mr. Modi's Prime Minister present that speech on that Independence Day, that time only I decided like lot of things are getting changed in Indian political perspective, and a lot of opportunities are coming in this Indian dental industry. And the only thing is initiative should be there in that. So I thought like why this Cosmo should not take that initiative, because we are in that service sector where we are educating, we are empowering the students to have the better life and better career in dentistry. So we thought of going with this kind of a initiation, so that whoever is having some kind of an extra ability or some intuitive mind, who can be a good entrepreneur, who can solve certain problems in the dentistry, and who can become one of the key member for our key member for the dental industry. So that's the reason I started this kind of webinar session over here. The concept here is to just understand what all opportunities are there in the market, and to ignite certain new mindset, so that they can come out with certain ideas. We can empower those ideas, and we can build up a kind of new startup ideas. We can build up new initiative. We can build up new service sector. We can come out with a new business solution for this industry. And when we're talking about this industry and dental and all, we are not limiting ourselves to only dental clinic related business. We are also looking towards what all other opportunities are there. When you think about dental clinic is a complete ecosystem. Okay, so in that ecosystem, it's not the dental procedure what we do. That skill is only required, like root canal, crown and bridge, implants and all. Apart from that, you are doing certain business, means certain services are needed for you. Like somebody is giving material supply to you, somebody is giving equipment supply to you, somebody is giving some maintenance service to you. So this is all called value chain. So a dentist knows better what all problems are there in their industry. He knows the pain points, and he can understand better to give solutions to those problems. So better to ignite this new generation dentists, so that they can think little out of the mind, out of the box kind of mindset, so that we can get more ideas and we can come out with the very good new solutions in the dental industry. Okay, so when we start up this webinar session, the very first thing came to our mind is at what time we should keep this. Day was confirmed, it should be on Sunday. Whether to keep it on morning time, whether to keep it in the evening time. So let us know that what is the most feasible and comfortable time for you. Don't think about others. What is the best suited time for you, so that we can keep this webinar, so that everyone can come and join to this webinar session. We want to understand the best possible time for a dentist. We don't want to disturb your practice. We don't want to disturb your personal life and your family time also. So just mention the best suited time for your webinar session. We want just 1.5 hour from yours. Okay, just comment in that chat box. Okay, now let us start with the presentation. Now, I welcome you all to this entrepreneurial journey, because this one step, because again, one question came in between. Why you are charging that 49 rupees? Why you are charging that 50 rupees? Either you charge 1,000, 2,000, or you don't charge. What is the idea behind going with this charges? The thing is, the business is all about money and profits. Okay, nothing comes free. बिजनेस में धंधे में कोई भी ऐसा फ्री में नहीं मिलता है. You have to have some kind of an efforts or some kind of monetary should be there. Then only people will be little attentive. फ्री में आता है तो उसका वैल्यू भी इतना नहीं रहता है. So we made a token price, so that gives us an idea that who are actually going for or looking for this kind of an entrepreneur mindset. So that gives for a businessman to understand who is really interested, who is just for the time pass sake they are coming. Okay. Now, when we think about this, about the entrepreneurship, so there are certain things or ideas we should think over here. Over here is like we are from such a community, or we are grown up in a society where everywhere we've been taught, or we've been grown up in a society where only we've been taught for education, learning, certificates, grades, marks, and all. nowhere we are thinking in that what actually we are learning, and for that what kind of value-based monetary we are getting on that. That we are wired in the sense like you just do the graduation, then post graduation, then PhD. But we're not thinking what after PhD, what after degree. Now we all know that the kind of degree what we took when we joined our BDS, especially the kids who joined the 10 years down the line, they all know that that time also dentist has no value in as such scope. Now also that is not having the as such scope, but still you people joined. So that means it's a elective choice. It's not like that now you can say that dentistry में कुछ नहीं है. Dentistry में, if you think about, there are n number of opportunities are there. But the thing is, the approach by yourself is most important over here. When I'm seeing the kind of approach, now this year only, our dental college has started taking MDS admissions. In that, what I'm seeing over there is people are spending around 50-60 lakhs for a PG seat. Imagine. Now, so, please don't take it otherwise. A very clear disclaimer over here is I'm not downgrading anyone, or I'm not praising anyone, or we are not promoting anyone. This is just a typical dande wala mindset ki what exactly is needed for the business that we are talking about here. Okay. Now, when you're spending this much, when I see them in the colleges and all, when we ask them to get one good textbook, when we ask them for purchasing of a good equipment, all they think a lot. This is called penny wise, pound foolish. You spend a seat for 50, 60 lakhs on that seat, but you are not ready to spend on yourself for your equipment and all. So this is something is the weird mindset which is not, which has to be broken down. We need to think little logical in the entrepreneur journey. We have to come out with certain ideas, rational for whatever the spending we are doing over here. Now, if you are spending around 50, 60 lakhs for a PG seat, first thing what we need to understand, in how many days I am going to retrieve that ROI, return on investment. Your root canal may be 4,000, 5,000. Okay. And for that 4,000 daily, you might be doing 10 to 12 hours. It is. You calculate. It will take years to get to recover that. And in fact, if you ask me, if you're coming to me, you might be a BDS. And if you're coming with a 50, 60 lakhs of an investment, I'll give you 100% guarantee that within the 2 to 3 years, you will be a typical settled practice. And I'm giving guarantee that at least 3 to 4 lakhs per month you can make it within that 3-4 years. Okay. So you need to think like where I'm putting money. For that money, what justification I have. Okay. So this is all about the session over here to understand what exactly we are going wrong and where we should focus on. The biggest myth in our industry is like, if you're having an MDS, then only you can flourish. I'll give you n number of example over here. Recently, the very new example from the Hyderabad itself. So way back in around 2018 or 19 something, my students only came for my implantology course. In the first module, they were there in the session. And I don't know what happened. They thought something because these all 4 guys were from the near around town places only. On that session, they came and 2-3 days, I think they did some kind of brainstorming. And when we called them for the next model, second model, में हम call किए तो they are like, sir, we changed our mindset now. Now we are going with a very big clinic setup. We all raised around 2 to 3 crores something money, and we are trying to build up a clinic of 3 crores. Then everyone was shocked. I was like, how come a dentist, that too from a town place, coming to the city and raising that amount and going for a high-end clinic? And unfortunately, very badly, they got hit with this COVID immediately after 1 year. And in between, two of their partners, they went off. And these 2 guys still stood over there. And now, when we see the progress of that hospital, now they from one branch to now they are grown up to 4 branches. But now recent development, what I heard is maybe right or wrong, but it is in the under pipeline that they are trying to sell this entire project to one high-end private limited company, which is going for an IP. Okay. which is going for listing or their private limited company equity listing. So they valued them for 7 times what the valuation is there. Means 3 crores, one claims, 4 claims. 12 crores is the only asset value, and valuation might be somewhere at 20-25 lakh crores. So imagine, let's take a lease to of the amount 15 crores into 7. I leave that figure, that images to yourself only. So that much amount that they are selling it to a big company. This is called acquisition, merger and acquisition. So they are getting merged with a higher brand over there. So within this 5 to 6 years, how much they earn? So 15 to 20 crores, because now only two are there, 30 to 35 crores. Which company where you are getting this much amount of this much amount of valuation? So never underestimate dental industry. And the point over here is all these 4 guys were BDS. So take out from your mind, key MDS is compulsion for a success of a business. Business is all about valuation. तुमने मेरे को क्या दिया, मैं उसके लिए पे करता हूँ. Even the cracks are flourishing. Cracks में क्या कर रहा है? वहां पे कौन जा रहा है? The one who cannot spend more than 100 rupees. And that guy, if you go to any lowest of the lowest small clinic also, you will charge somewhere 100, 200 for the consultation, 100, 200 for X-ray, and 100, 200 for the treatment. So he will lose somewhere 7 to 800. But that is not his capacity. So his capacity is only 100, 200. And who is there for 100, 200? That quack is there. So that's why quacks are flourishing. That doesn't mean that quacks are your competitors. So irrespective of the government regulations, मार्केट मीन्स द सर्विस, वैल्यू बेस्ड सर्विस. तुम मेरे को क्या दे रहे हो उस हिसाब से मैं तुमको पैसा दो. So that mindset we have to develop in the business sector. Okay. Now, what is entrepreneurship that we understand now? Before you get into this entrepreneurship, 2-3 words we need to understand over here. Okay. So that is like as being a dentist, what we do generally. Excuse me. इसको बड़ा करना, इसको छोटा करना, वर्टिकल मारा था ना. Some windows to be on, these not necessarily was presentation. Yeah. Sorry. Being a dentist, what we do, we take an admission into a dental college, we get graduated from there. Then you go to certain courses and you learn certain things and start your own practice. So this is something called a self-employed business. That means you are employing yourself. Like rather than going to some other clinic and work as an employee, you are getting employed by yourself. That is called self-employment business. Neither this is a typical employee, neither this is a typical business process. But this is the one of the traditional thing what we generally do in our professional practice. Now this is more of a professionalism, like professional self-employed kind of practice, like doctors, CAs or lawyers, and these all people used to. So here, this business, the self-employed is a person-centric, like whatever skills you have, for that skill, certain people come, they get the service done. And for you, there are certain helping people, hands will be there, like dental assistant, your receptionist, like this. So these all people are helping you, and they are also getting employed under you, and you self-employed there. No, this is one of the wonderful concept, and it's a typical doctor-based kind of professional concept. The problem with the self-employed is like you go to certain level, like you might be earning 2 lakhs, 3 lakhs, 5 lakhs, max to max 10 lakhs, and there is a cap. No, there is no growth. So this is something, if you escalate, suppose you are having very good business, now you wanted to expand. What you do now? Now you added little more dental chairs. Okay, you expanded the clinic, and there around 4 to 5 chairs are there, and you appointed endodontist, prosthodontist, okay, and orthodontist, all full timers. They are taking care of all your patients. You're not doing any cases now. You are just observing the business over there. So here is something the business concept comes. Self-employed where you are working. Now this is the business where other people are working. You are just monitoring and you are encashing that business over there. So the biggest advantage of this over here is, suppose you want to take a holiday, you can go there. You are chilling in the Goa beaches, having a beer, but still your business is working over. But in case of self-employed, if you want to take a leave, then your business is completely down. Your cash flow is stopped. So that is the biggest disadvantage over there. So this is an escalation kind of a thing. Like first you are an employee, then self-employed. Now you are a businessman. But what we are trying to establish over here is we are trying to understand what is this entrepreneurship. Now this is an extra level of this business concept. That's the entrepreneurship concept. Now here, a guy who understands the gaps in that sector, he is not going to innovate anything something new. Under the circumstances, if any problem is there, he try to solve those problems over there. Okay, like you take an example of aligners. Okay, now when you want to give an aligner kind of service to the patient, what we used to do, we convince the patient for aligner, orthodontic aligner case. You take scanning. That scan you send it to that lab, that aligners lab. There, an orthodontist will be sitting over there. He'll analyze your data, and he will come out with certain treatment plans, and he'll create certain aligner sets over there. And he'll give clear instructions of that 1 year, and entire sets they'll send it to you, send it to the doctor, and doctor is delivering those aligners over there. Now the thing is, when you think about as a business perspective, what exactly this dentist is doing? Dentist is just catching the patient, doing the scanning, and delivering the aligners. As such, his role is not there, but the kind of profit he is making is tremendous. Suppose your aligners is charging somewhere around 25 to 30,000. Now your doctor, that dentist is charging somewhere 1 to 1.5 lakhs or 2 lakhs somewhere. Now the problem over here is there is no role of a dentist. Literally, he's just is as a middle person, but taking away around 3 times, 4 times of the profit. Then what this Toothsy aligners company like Praveen Shetty and his friends, what they thought is, why don't we directly reach out to the customer? It's called B2C. So any business, suppose aligners are coming from one business entity to the dentist, another business entity, it is called B2B business. And this dentist as a business clinic entity is giving service to the customer. So B2C. Now what they did, they directly started their business from B2C. They took away the middle wala dentist. So because of that, what happened? Because of that, what happened now? They are reaching directly to the customer. The profit margin has increased 10 times because they have to have their running cost, production cost, okay, then the service cost, okay, then courier charges and all, everything, they are bearing it. And they're making somewhere around 50% of the profit. Now that has increased to 10 times. So that's how the business concept came for Toothsick, where the lab is directly attracting the patient. So they are going door to door and giving the services. So one thing, the patient is getting services at his doorstep. Second thing, profit margins are 10 times increase. Now, when they listed their company, it valued like anything. The biggest advantage of a medical industry in today's era is like investors are crazy about medical industry. If you have very good thought process, what they feel is like dental people or the professionals and this typical doctors are very much transparent people. So they believe us a lot. So if you are having this kind of a tech background and you're trying to establish a startup, they are ready to give n number of valuation. Okay. Now that tooth aligner company valuation is 1400 crores. And if you see their asset, they might be having max to max 50 to 60 crores of labs and all. But the kind of valuation they got is huge. So that's what we need to understand over here is rather than just sitting behind this business, trying to understand the value chain over here, where we can think of so that we can solve a problem. To that problem, we can be an entrepreneur over there, where everybody is getting benefited over there. That is the biggest advantage of entrepreneurship. What the entrepreneurship does actually over here is he tries to solve a problem or tries to fill up the gap which is there in that business sector. So that is the biggest advantage of this entrepreneur. Now, the example of this entrepreneurship is like starting a chain of dental clinic, okay, or launching your aligner or manufacturing company or any service sector over there. Now, let us start like how this entrepreneurship journey starts. Okay, so to start this, we need to have a proper idea where we are trying to solve a problem. It's called a startup process or startup company. The meaning of a startup is like now they have got a huge potential business in their hand, but it is not tried and tested. But the idea is good, concept is good. If they try to create a business model, uh, 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 it can be valued at n number of amount. Okay, but the thing is now these people are very small. They don't have that much capital. They don't have that much experience. They don't know how to go to the market and all. But you have got an idea. So, but somewhere you have to start. So that starting process is the startup process. Okay. Now the idea is like I'll give you a small example just to understand. Okay. Suppose you wanted to create certain videos or animations where you are explaining, you are giving those videos to the doctors, and that doctor is explaining to the patient. Like suppose a patient comes for a root canal. Now there's a procedure of root canal, animations of root canal, pre-op instruction, post-op instruction, everything is there. Then if an extraction case is there, how do you do go for extraction, pre, post, anesthesia, everything you animated all these things like that. All the procedures you have that animated videos and then instructions. Now you give that animations and videos to around 10 to 20 doctors around you and let them use it free of cost. And you take feedback after 1 month, 2 months, 3 months. If that really is increasing their business revenue or that it is converting the patient, that means your idea is working. Now you got a immense response like, hey, wow, the people are getting crazy on that and they are happy with this and all. Then your idea is 100%, 100% is okay. Next is conceptualize. Now the idea got conceptualized. If they tried it and they are giving the wow factor and that feedback is good, then the idea got into concept. Now that concept, you have to make a prototype so that you can sell it. Now in this process, like you went with this kind of animated videos and all. Now there is a high chances that you gave that videos to one dentist. He may just give it to some other dentist. They make a copy, paste it, and they can circulate it. So now you have to come out with an ideation like how to capitalize that. You might with an app where all the videos are been properly segregated, indexation is been done, and you are giving at a subscription rate. Okay, so if you go for certain amount, this much of subscription amount is there for this many videos are there like that. Somehow, whatever the ideation you want, you have to come out with some tech background kind of an app over there and go for IP filing over there because intellectual properties is the most important one because see your idea may be small or big, you don't know what is the potential of that because you are also trying and it may be something can trigger any kind of high-end business also. So first of all, what first thing you should do is go for an IP filing go for a proper registration of the whatever the processes are there. And if at all you want to give any name and all, start with the naming and registration of that names, and then temporary TM registration and all. That all things you should do first. Now the next is, once you develop that app should be given to few more dentists. Like now you give to 100 dentists. Now this is a pilot project. It's called prototype. Okay. And on that pilot project, let them do it. Any hassles are there. Like it is a tech-based app. So you may get some glitches, you may get some feedback and all. Work on that. Now, once everything is done, now it is completely glitches free and ready to go to the market. And now you want to expand the business, but you don't have money. You want to expand pan India. And that idea can be copied or it can be done with some other competitor also. So what you can do now is you have to sit with the business people. There are service sectors are there. Even Cosmo can guide you on that. So there you are making that prototype and ready to go for pitching. Pitching means you present this, whatever the model in front of the investors. And if it is ready to go and if the investors get confidence in that, they will fund you. And that on that basis of fund, now you go to the next level. Now you expand, you create your own offices, and then the typical hierarchy, HR you manage, and the marketing you start. So you need budget on that, and now you get the fund, so you can easily do the proper marketing and start doing the business over there. Now you got very good response over there. Then you can go for the next round of funding, like that. So this is how the process starts. I just explained it so that you can understand how we should go for an ideation and conceptualization. The biggest hurdle is the prototype. Ideas, everyone has different ideas. बाजार में इतने लोग इतने आइडिया के साथ बैठे हुए हैं कि there is no limit. Then next is conceptualization. There are few people come to this conceptualized. कुछ लोगों को दिया, आइडिया बनाया, कुछ यूज किए. Then you got some kind of a response over there, like that. Then the prototype. Now you need to acquire certain tech people. You need to have a proper business partners or employees who you can rely on them. Those who can do little more extra work for you, because now you are not in a position to pay them more. But you have got an idea and they should align with those ideas. So they can be an investor partner or they can be your partners also in the near future. So this, once you come to this prototype level, then it is all about the business, is all about the market. Okay. So why we are discussing all this kind of entrepreneurship, business and all? The thing is, things are changed now. The market, what we saw in the 90s, and the market we saw in 2000, the early 2000 areas, and the market, what we are seeing today is it tremendously changed. Okay. Gone are the days like आप एक clinic लगाया, बस एक 2-4 साल बैठ जाओ, mouth to mouth publicity हो जाएगी, and automatically doctor get flourished. So there is an iconic image for the doctor. Is like he is a professional, एक good well-being है, सबको अच्छी बात करना है, सबका अच्छा सोचना है. But money related बात वो नहीं करना है. The moment we keep talking in some kind of monetary, पैसे की बात कर रहे हो, या you are talking about the profits, margins, then we feel little awkward. Now also, whenever we go to any conference or whenever we talk about the business or kind of profits and all, even now also doctors feel little uncomfortable. That we need to change. That the change is coming now. Second biggest change is like the typical Babu culture. Whenever we want to go for a new business and all, there used to be a lot of hurdles from the government side. Now that aspect has changed. Now, in fact, from this Modi era is like tremendous help is there from the government side also. The only thing is you should have the best idea. There are n number of investors are there, n number of business network people are there. They can help you out. Even the government side, they can aid you also. It's a typical example is T Hub. If you just go there and try to present your idea, they will help you a lot. So that kind of a change has come. Now, what need to be changed? we need to think, the dentist and the doctor has to think in little out of the box. Ki bhai, only root canal or crown and bridge is not the only business in dental industry. There's some other things also. Now the biggest change has come in the government sector is they just want to go with the manufacturing also. So they want to push a lot in manufacturing. So we are exactly like in a stage where 20 years back China used to be there. 20 years back that South Korea used to be there. 20 years back that Vietnam used to be there. And this phase is something like for any business to grow exponentially, this is the right phase. This rapid urbanization is going on. People from the rural area are coming to cities, from cities to metro cities. Within the metro cities also, suburban areas, people are migrating to the urban areas. Okay. Anyone from this Kotape, Uppal, Secunderabad area, everyone want to migrate to Kondapur. Why? Better lifestyle, better amenities. Okay. When the better lifestyle, better amenities there, spending power will increase, infrastructure will increase. So this automatically will change the behavioral pattern of spending. We know that in our when we are kids. So हमारे टाइम में tourism बोलते क्या था? Like if you want to go for outing, या तो तिरुपति चले जाओ या शिरडी चले जाओ. Okay. टिपिकल अपना ट्रेन में बैठने का, घर से पूरा पैक करके लेके जाने के, घर वहीं जाके धर्मशाला में रहने के. So it is not like they don't have the money. They have the money, but the spending behavior was not there. Everyone is like save karo kind of a thing. But now things have changed. Now when you see the family size, they are hardly having two kids. Now the new concept is only one kid concept has come. Maybe 10 years down the line, no kid concept will come. Maybe after 20 years, no marriage concept can come. Things are evolving like that. It is not new. You can see the Japanese side and the Korean side and the China side and all. They don't want kids. They are pet lovers. So this change will come to India also. The thing is, population, the demographic advantage is there. The biggest advantage now everyone is in the highest spending capacity and earning capacity. Now in this era also, if you try to go with the same age-old pattern, वही तुम 2000-4000 में को अटक के रहोगे. Where we should go to a level that now my customer is spending 10-15,000 for root canal. My customer is spending 25 to 30,000 for a crown and all. This can only happen if you invest in that way, if you project your value in that way. Okay. So this is what the exact change has happened to that sector over there regarding Gen Z and all. I have a separate session on this, how to capture this Gen Z, Zen Alpha, and millennial concept. Millennials are now the typical entrepreneurs will be there. But how to capture the Gen Z, how to capture Zen Alpha. Okay. Now the thing is, what is Gen Z and Zen Alpha? A kid who born in somewhere in 98, 200, some kind of 2000 something, where the TVs used to be there, cable used to be the high funda, then slowly internet came in, and they grow with the internet expands. Then they saw the normal phones followed by this smartphones and all. Zen Alpha, by birth they started with the smartphone. Now this era, this generation has got a different ideation concept. We cannot compare with the millennial generation with them. So when we think about the clinic setup and the service sector, we need to, I'll talk a lot on this, because what happens whenever a parent or any seniors try to give an advice, what they see generally, कि अभी कौन successful है? Like suppose any parent come to my clinic, what they say, अरे इतने chairs है, सब settled है, husband wife साथ में रहते हैं, everything settled, अरे dentistry बहुत अच्छा है. And like that, if they think and what they feel कि अरे हमारे बच्चे को मैं dentistry करवाऊंगा. Now what has changed over here? The thing is, I was successful because I started 20 years back. Now that kid is going to start 10 years down the line. So there is a huge 2-generation gap. So whenever you want to put up a new business, you want to think of a new startup, a new entrepreneurship or business idea, think about the 10 years later kind of a mindset, 10 years later market size and market potential. So that's what the missing in typical dentist mindset. Okay, this we'll discuss later. What is the opportunity as a business? First of all, rising middle class income. So for any dentist, who is most potential customer is the middle class. Rich class, their already clientele are set. Okay, we are not focusing on the celebrities and all. What we are focusing on someone who can spend, who can come to our clinic and get the treatment. Okay, so this is rising middle class income is they are ready to spend for a branded company or a trend set company. So like that, we need to understand over there. There is an increase in spending behavior. Now, typically, who is earning around 1-2 lakhs per month, to think about spending on an oral cavity around 4-5 thousand for a cleaning, scaling, or any bleaching kind of a thing. Okay. Now now what the change has come in this new era is like any sector you take, maybe normal chai wala also, everyone is coming with a typical branding. Okay. And with the brand, there is a trend also. So this we need to understand what brand, how we are going to increase the brand value. At the same time, how we are going to be a trendsetter in the business. So if you get this opportunity, if you have an idea, try to focus on that brand and trend. Okay. Then everything is revolving around fashion or trend. Earlier, what we used to think, कुछ भी अगर सामान लेना रहा या कोई व्हीकल लेना रहा, anything you want to try to purchase, उसको लॉन्ग टर्म यूज देखते थे, रिव्यूज देखते थे, कितने दिन चलेगा, ओके, मजबूती देखते थे, वारंटी गारंटी देखते थे. बट नाउ इट इज द कॉन्सेप्ट हैज चेंज्ड. व्हाट वी वांट अ ट्रेंडी थिंग. फैशन आज जो फैशन में चल रहा है वही चाहिए मेरे पास. That's the way. If you see the Tata brand over here, earlier they used to have this West Side. Now they only come out with another outlet, which is क्या नाम है उसका West Side का? West Side.
Zudio.
Yes, Zudio. Now Zudio is a sister concern of this West Side only. Now the concept of Zudio is simple. Everywhere glasses. Okay. Everywhere you have this clothes and which is visible with the price tag. So whoever is coming around, like Monday, they should see that okay, ये dress है, ये trend में चल रहा है, इसका price. Okay, that's what the things are going. Now another change has come in the marketing sector also. Now there is no value of this SEO concept. Earlier, like you need to build up a website, think much over the branding, page, content, and now AI is giving the gist of that. So it is no customer is not going directly to any website now.
Payment in that.
So AI is directly giving that
China
option.
bridge.
Excuse me. I think and one is there, just one audio is there, just mute it. Sorry. Yeah. So now what the trend is there in the digital marketing? Trend is there like influencers. Okay. Everyone is following that typical Instagram, and there the influencer come and they give some kind of they show certain kind of products, and they tactfully they try to project something over there, and people are rushing over there. This is what we need to understand. What is going in the fashion, what is going in the trend, who is the proper influencer, how to get them, how to market it. So we need to change as per the time. Okay. So value-based market pricing is like people know that, like on the Instagram, like small things are there. You can see a lot of electronics things, even the scrubber. If you can see the any belts, clothes, and everything, they're just selling on just social media platform. That's it. So that's what an opportunity lying over here. You don't need to again compete with the SEO website and all. And this will surely increase the dental demand also. How we're going to increase that we need to see that. The very first thing what we need to understand is this kind of a setup, this kind of an old fashioned type of an dental clinics are not going to work. And we should think little beyond this. So I have, as I told, like in the part 2 or part 3, we'll discuss in detail about that, how to go for a dental clinic setup in this new era. Okay. So today we are just focusing on how to go for a startup idea and how to conceptualize that. Okay. So what all things are there which are beyond the dental clinic business? Okay. So as per my knowledge, I categorize into 4 sectors. Okay. One is the traditional clinic based business. Now the thing is, there are a number of clinics are there in the market, and you want to go with a new clinic. What the big deal? What change you are doing over there? One thing we need to understand over here, going just with a normal traditional dental clinic, it's not going to work. We have to go with a certain USP or some tech background or certain wow factor, then only we are going to survive. So how to go with this clinic based business, how to go with this franchisee concept, what all types of franchises are there, and how to go with a tech enabled dental clinic, how to make a paperless dental clinics, how to go with the new ideas of a dental clinic, that I'm going to discuss in the later part. Now, this is something to go for an ideation part. Okay. So what next sector left over here is the manufacturing sector. Under the manufacturing sector, now this is something I don't advise because this requires heavy investments. Okay. You need to invest a lot on the infrastructure and the procurement, and a lot of contacts are needed over this. But if at all you are having a family background, your brother, sister, or you might be having your parents who was into the CNC milling machine, those who are into export import business, they can think of this manufacturing sector. Okay. One thing is there is like government is very much interested to push this sector. If you are having that kind of a background and you want to set up or you want to go with manufacturing, this is the best time to go for the manufacturing. Okay. What all things can be manufactured? One thing is established, one is the dental implants. But I suggest that dental implant is a very niche factor. The amount of user base is very less. Instead of that, if you can think of going with the components of dental implants like drills, kits, expanders, instruments. So these all things no implant manufacturer is going to manufacture. Even the implant manufacturer also they go for a third party to have to procure that kit and drills. And if you cater that, automatically all the dental implants company are your customers. At the same time, you can directly catch for your B2C business also. So dental kits is one of the idea to go with the manufacturing. Then the dental instruments. Yes. So nowadays, rerouting is going on. Like the best instruments are getting manufactured in this typical Pathankot, Sialkot, Pakistan. From there, they export to China. From China to Dubai, it will come. From Dubai, it is coming to India. Now, the thing which can be done in Sialkot, Pathankot, why it can't be done in Punjab, why it can't be done in Haryana? Okay, so that kind of talent is there with us. If anyone is having that kind of a background, they can come out with this instrumentation idea. Again, don't go with the typical traditional business center. Think something logically, think something extra over there, and try to come out with the value-based company over there. Then consumables is again, I don't have much knowledge on this for the material manufacturing and all. If at all I get any kind of expertise on this, I'll definitely try to arrange one webinar with them. Then RC files. Yes, this is one of the most important thing in every dental clinic, and every day it has been used. Every dentist will definitely purchase 100, 200 RC files. Maybe it is hand file or rotary files, NITA files, whatever it is there. And if you are having that typical CNC milling background, then you can definitely think over the RC file. I don't know why people are not going for that RC file, but this is one of the things where you can think over. Then comes aligners. It's already discussed, and digital labs. Yes. Still, we are struggling with the proper working labs. This is also one of the value-based chain if you want to go with the manufacturing. Equipments. Okay. Again, this is high value based kind of a thing like manufacturing. See, equipment has an advantage. You don't need to manufacture. Suppose you want to go in an equipment sector, you can procure all kinds of spare parts. from Vietnam, so Korea and China and all. Then you can assemble over here and come out with a product. The thing is, there should be some kind of an ideation thought process so that you are solving some problem over there. It's not that already so many implant chair manufacturers are there. What extra you are doing in that? So if you really want to add some value, come out with a different ideology so that people should think over that इसका chair अच्छा है. ठीक है? Then coming to the compressors, yes, this is one of the niche product. आज तक मैं जितने भी compressors देख रहा हूँ, it is still in the same traditional setup only. Autoclave change हुए अपने, but compressor change नहीं हुए. Light क्यों change हुए अपने, लेकिन compressor couldn't change. Recently, I saw one compressor. It's a screw type compressor, beautiful one. If anyone wants to customize that for dental clinic, that is going to be one of the best thing to go with. The screw compressors. These screw compressors are starting from 10 HP, but we don't require that much of high end. Generally, DMLS and dental labs, if it is a very big one, they used to go with the screw compressors. This is something like where you can think of if you're having any idea on that, you can go with this kind of a business sector also. Autoclaves, don't go with the same idea. Again, traditional one, your autoclave should be something extra over there. Okay. Suction machines are there, special disinfecting machines. Again, trendy things are there. If you see in Instagram and all, scrubbers rehndo, yeah, small electronic things rehndo, nail clipper rehndo, they are coming with different ideas. Best way, always remember, yearly once you should go to Gonzoi China conference. There you get the typical idea. If you are really interested in manufacturing sector, go to those conferences. Small things they manufacture. And it is really solving a lot of problems. Okay. Then aerosol control machines, UV cabinet. So many things are there. Suppose you are interested, come out with an ideation and a prototype. Definitely we can sit on that and we can think over the business aspect on that. Then the third sector, the service sector. Okay. Now, service sector, when you see the dental clinic and all, what we are regularly facing problems is the clinic maintenance. Maintenance means day-to-day work. Suppose you are having 3-4 clinics. Then you are sitting at one clinic. You don't know what is happening in another clinic. So to have a transparency, to make a track on what your employees are doing, how many patients they are doing, how much the transactions are going on, how the inventory is going on there. For all this, you need some software. It's called ERP software. So clinic maintenance software. You can come out with an AI model over there where it can be little more problem solving kind of a thing. Like generally what problem would we face over here is if any patient comes, generally we take down the names and the number, whatever the software we take, like Practo, Denti, and all these are called ERP softwares. What we are doing there, we take the name, we enter the number, and you are using that entire software only to schedule or reschedule or data. That's it. But we are not keeping any inventory in that app. We are not maintaining any kind of an HR in that. We are not maintaining any dental lab data on that. Okay. So what we need to understand, like why software is there with all these options, but people are not adding over there. So somewhere something gap is there. Try to find out and come out with a solution for that gap. Then automatically your ERP software will be successful. If you are typically making that copy paste, it's not going to work. Then equipment service. Again, the very big headache in dental clinic practice is equipments. Like OPG is there, CBCT is there, RVG is there. Okay, your aerotors are there, your compressors are there. Any problem comes. Now, what happens? Our dental community is very small. So big companies, they give it to the distributor will sell it to us. Now, if any problem comes, you keep on calling this guy, that guy is like, sir, mera nahi, wo manufacturer isko phone karo, usko phone karo. It's like you don't get proper response. Till that warranty guarantee is there, it's fine. And many times what happens, like the person who sell it to you, that representative, वो अपना कंपनी चेंज कर देता है. वो बोलेगा सर मैं वो कंपनी में नहीं हूँ, हम ये कंपनी में आ गया हूँ. So who is going to solve that problem? Now it's not like that कि वो बड़े-बड़े companies are not interested to go for the maintenance. They are ready to go it, but sector is small. They might be keeping around 2-3 technicians for entire India. अब एक प्रॉब्लम आया पोर्ट प्लेन में, सेकंड प्रॉब्लम है दिल्ली में. So how they coordinate? So the business opportunity over here is you come out with a solution. You create an entire ecosystem over there. You train certain technicians who can do all kinds of maintenance. He can do OPG repair, he can do compressor repair, he can do chair repair, he can do say CBCT machine repair, he can do RVG, next every repair they can do it. Like that, you maintain this proper manpower, and for each metro city you make one office over there and create one app and go to that manufacturer. Like suppose somebody is OPG machine वाला manufacturer है who is selling into India. उसको बोलना है कि sell तो करेगा, service मैं दूंगा. There is a B2B contract. Now for them this is very easy to go. They don't need to take this headache of maintenance. No, you are taking that care. Now monthly basis you are getting certain amount from that head office. Now you are giving service to this clinicians. Now the advantage over here is suppose you have got a problem with your compressor, you have problem got with OPGs, a problem got with RVG, everything is getting solved by one person only, one agency only. And there's a typical customer care and there's a feedback mechanism, everything is there so that you get to know, you can solve problem very easily over there. Somebody is want to do this, this is one of the beautiful sector to go with. Then the manpower consultation, again the biggest hurdle in dental clinic business is dental assistant. We don't have any proper agency which can give a trained dental assistant to you. Okay, excuse me. Time बोलते रहना. 1 o'clock. Okay. So just within 15-20 minutes, I'll conclude. If at all anything is remaining, we can have the next in that next session also. Okay, where we are manpower consultancy. Now we are struggling with dental assistants. Now, what you can think over here, there are certain HR agencies which are deploying this watchmen or the security guards. Now they train the security guards, all this retired people they take, and for each apartment they used to deploy this people over there. 8 hours their time slot will be there. Now, as a community head, what I do, I just go for this consultancy. They will provide this service to me. I am paying my whatever the fees is there to that consultancy. They are paying that salary to those security guards. So within a shift, they are coming. The biggest hurdle or the problem comes like if you are owning the security guard by yourself. If suppose he is going on leave, there's no alternative. The biggest advantage with this agencies are like they will replace it. Like that in a dental assistant job portal also. Suppose you are having a single dental chair where you can afford only one dental assistant. And suppose that dental assistant is on leave, then what? So you are in problem. And suppose you are having extended time setups, like you are starting clinic at 9:30 and you are closing at 9:30, 10 o'clock. It is highly impossible that one attendant will be there from the throughout time. So there, if you can come out with this HR consultancy agency where you're having hundreds of dental assistants in each area, where you are taking contracts from all these clinics, you just deploy them here and there. Typical 8 hours, 9 hours, whatever the salary base is there, accordingly you deploy them. If anyone is not coming, you just replace them. So this is something like ready to go kind of a business. Only thing is you have to have a right mindset. You can think over this. Then the patient referral consultancy. A lot of many agencies are there for this patient referral consultancy. A lot of competition is already there in this. Then mobile dental clinic or home dental services. There are certain startup initiatives they started like they're going to home and they're giving the at-home services and all. This is already an established kind of an agency. Here also you can think with little more logical over there. The fourth one is this educational. Like you know that the dental college, the kind of gap we see in dental education and the actual dental practice. Here also we can capture over there, like which can start your online academy or offline academy. Like Kosmo Dental, you can start up with this kind of a business where you go with 2, 3, 4 good speakers, and then try to have on-patient training. Like offline academy are getting only failed because of on-patient training. If you have got good patient flow, just contact us. We'll give you complete guidelines on that, how to go with that business. We have got ready to go formula on that for an academy. Online academy, yes, you can do over there. Whoever is the the prominent speakers are there, whatever their the best topics are there, try to approach them, okay, and try to record their all the sessions and create one app where everything is there. Implant, if you want, implant is there. If you want an is the dentist is there. If you want a cementation one, it is there. The same time, you can go with the PGs and UGs also, like all kinds of lectures, like first year lecture, second year lecture, third year lectures, like that. All this kind of videos you make offline recording, like Byju's and all. Now you sell that on a subscription basis. What you want? You want only implant? You go with the implant sessions. You want only with the root canal? You can go with like with the root canal kind of a thing. This is also one of the best option to go with an online academy rather than just going with a webinar and arranging kind of thing. It's typically whoever is having the best time at that time, they just open up and they can learn online. Then a typical Zenzi type of wow factor softwares, like now what we can see here is like, what is that? One camera is there, it's an OPD which will scanner. Okay. The scanner is a very good concept of attracting the patients. Actually, it is not adding much value. But the thing is that wow factor is there. Okay, the dentist is there where AI-based software is there, which when you take, it will click that photograph by itself, it will take down all the details and it is giving the diagnosis also. Actually, it's hardly what you have. If any black spots are there, it's a caries. If any ulcer or something is there, it shows an ulcer. So for an AI, it is very simple. The thing is ideation. Like लोगों को how to बेवकूफ कैसा बनाना is simple as an AI only. Okay. I'll suggest one movie. Everyone should see that movie. It's like uh, Chinatown. No, not Chinatown. It was like I'll put it in basis. I forgot that name, where the Paresh Rawal is trying to give one beautiful idea, business concept in that. A typical Guju community trying to establish one business which is 100% successful. Okay, so in that, lot of logics are there, business logics, how to attract the customer, that kind of logics are there. Typical tips and tricks are there in that. Huh? I don't know, made in some China related kind of thing is there. Okay. Okay. So like that, you can come out with the software. Like now you have that smile designing software is there. You can make it completely free of cost. And where you're asking the your customer to click the certain photographs and just upload into that software. Software itself is giving certain comments on that. And you already now that patient knows that there is some problem, but he wanted some concept, some confirmation on that. When you click it and that software itself is showing certain problems, this is problems are there. Now he got to know that this problem is there, and AI is only giving the options over there. And whoever is the network clinics are there, now you will try to send that patient to those network clinics. Okay, this is how that software. The biggest catch over here is now they are directly reaching to the customer, and that customer is you are sending it to the clinics over there. Okay. Now, what is the biggest hurdle for a patient to come to a clinic? When his thought process, अगर मैं जाऊंगा, मेरे को कंसल्टेशन देना पड़ेगा, 300-400 वहां जाएगा. अगर एक्सरे बोला तो करना पड़ेगा, 2-3 तो वहां जाएगा. If something is there without any spending they are giving, they are happy. Like this software, it will go. Next is like, don't ask them to come to clinic. You go for a teleconsultations. You should have that app where you're calling them on the Zoom, where your junior doctor will sit and try to explain what problem is there. Then they understand, okay, there is a problem. Now somebody is counseling on that. And definitely that customer said, your customers now. So rather than going with only typical traditional business, you need to think a little logically that आज के डेट में क्या हो सकता है. Like that, we need to think over here. Okay, you can go with the clinic managed ERP software that we already discussed. Third party insurance. India needs very badly this. Okay, that insurance sector. We are just waiting for that. We applied for the NABH and we are trying to expand our franchise clinic and on an NABH level only to cater this third party insurance. At the moment insurance comes to dental sector, definitely what they see that how many clinics are there in your branch portfolio and how many cities you cover, how much of the customer base you have, and the charges. And they want something, an accreditation kind of a thing. It can be NABH or any kind of a QCI. They just want like to authenticate yourself case like you are a proper quality dental surgeon over there. Then you can have this dental chair rental kind of a business. Now, a very good concept is there in this general practitioners. Now, what these people are coming, they try to consult all this small nursing care units. And this nursing care unit means they have the beds, they have the OTs, but they don't have that much patient flow. Now, so many theaters and so many beds are vacant over there. There are certain clinicians like pediatrician is there, ENT people are there, or certain dermatologists are there. Now they are doing general OPDs is only on the medicine based. But if they require any hospitalization, where they need some nursing staff, some IV लगाना है किसको या किसी को OT में लेके जाना है 1-2 days का एडमिट कराना है. No, these people doesn't have that infrastructure. अगर रखना है तो फिर उसको उतना infrastructure spend करना पड़ेगा. So what these people are doing now, they are trying to connect this nursing homes to the day-to-day practitioners. So दोनों का प्रॉब्लम सॉल्व हो गया ना. जिसका भी नर्सिंग होम है जिसके बेड ऐसे वैकेंट जा रहे थे, नो somebody else is coming and getting occupied. इसको बिजनेस मिला. सेकंड थिंग, उसको जो ओपीडी बेस वाला डॉक्टर था, now he is getting the best treatment done in a very good infrastructure at a very low cost. Now the funda is simple: minimum investment, maximum revenue. That's what the whole concept is going on here. Then digital marketing software, a number of already established people are there in this. Then patient referral program software. Patient referral program is, as I told earlier, is like you should have an AI-based tech software where you have a teleconsultation, where you have this patient acquisition data, and then you're transferring, like track to what is doing over there. So this is a kind of a software development or tech development kind of a thing you can think of this. Okay. So how to start this? I think we are done with the session, the time over here. I don't want to drag for more time over here. So what I'm trying to make you realize that the clinic is not just a dental clinic now. Clinic has got an ecosystem. Think little out of the box. Any ideation you have, do discuss with us. Okay. What we want is like, don't just come out with the vague ideas. We want typical conceptualization. You try it. We want little feedbacks. If it is working, then 100% Cosmo is there to guide you in all the steps. Okay. We have got ready to go investors. The moment you are having this conceptualization, if you see, one thing is there for a step 1, step 2, like ideation, conceptualization, prototype. You need to spend from your side, because till we understand what exactly the outcome is there, nobody is going to put money. Maybe you are very nearby friends, your father, your mother, your sister, somebody is there, close relative, those who believe on your ideology and concept, they can contribute that. Till prototype, you make it. Then we can think about how we can make it as a ready to go as a business model, how to create a pitch for that, and what kind of evaluation will be there for that. That we can discuss. Okay. So let me conclude this how to go with the startup and how to go with the funding and all. In the next session, I'll describe this. Okay. So this is my Insta ID. You can scan it and connect over there. And this is my phone number. You can WhatsApp any damn thing is there. You can connect me or you can call me. This is my mail ID. This is my company mail ID. My personal one only. So thank you for your all question, patience listening. I don't know how much you understood. Uh, what I wanted to make you realize that dentistry is far beyond our dental procedures. Think over that. Okay. And if you have any idea, please do discuss. Thank you. Let me call upon this my co-panelist if we can add on this. And if any questions are there, let me go get it. Anything if you want to ask something within 5-10 minutes, please do let me know so that we can within 10 minutes we can take that questions also. You can unmute and talk. Let us finish up this our co-panelist, whatever his ideation is there on this. Dr. Chaitanya, please.
All right. Am I audible?
Yeah.
Okay. Thank you very much, Dr. Anil, for the wonderful speech, a wonderful talk. Actually, I mean, Anil didn't said this, but we are childhood buddies, and he's my classmate. And well, he's one of those guys from our class who everyone looks at so respectfully, and I really appreciate the progress Anil has made. So well, I'm not a dentist, so I might not be able to talk on the technical aspects, but well, I can tell you, of course, about the business opportunities for dentists in Japan and in general. Well, after listening to Anil's speech, I mean, indeed, this is those people who are thinking of startups. I think this is a great presentation. And I never thought like there would be such a big ecosystem of this dentistry. Like I mean, whenever I visit India, like of course I visit Anil, and I mean I just saw his clinic and things I see. But after listening to him, I found that there are many branches, and of course, like every sector might be having that. I mean, has that, but this is a what do you say? A great I mean sector for a startup. See, since I'm in Japan, I'll take a few minutes to speak
Yeah.
on Japan related, in the context of Japan. See, Japanese society and India. Well, since I'm an Indian, I have lived almost half of my life in India, and since last 18 years, I'm in Japan, so I know both the cultures. See, in Japan, people are very conscious. They emphasize on preventive dentistry. I mean, preventions. Like even if you don't have any problem related to your like dental, thing, dental health, but still they have regular checkups right from the school, and elderly people as well. So that's a huge, I think, I mean, not only support, but is it helps the dental doctors to flourish in Japan. And also the number of dental doctors in Japan, it is very high. The number of dental doctors per 100 persons. I mean, the ratio is very high compared to other countries. And Japan is one of the rapidly aging population, and that's why that there are more. What do you say? That the need is increasing. Like every year, people visiting dental clinics. I mean, anyway, as I just said, regular checkups are there, but in addition to that, also, I mean, the patients, they tend to visit.
And recently, I need to ask this to Anil. And recently, I heard this news that Japanese doctors, they kind of invented or some medicine which grow,
Yeah.
their dental roots. I don't know. I'm not expert, so I had this question. I was thinking to ask you when I visit India. So like how people. I mean, it shows like how much research is going on in Japan. Anil might talk on this. Answer this question later. Okay, and now it comes the opportunity for foreign doctors. I mean, including of course Indian. See, as I said, the population is like getting older and older, so the manpower is very less. I mean, it's needed. It means a lot of foreign workers, they are entering Japan. And in our Facebook groups, like those foreigners face group, they always ask, do you know any dentist who can speak English? So the doctors, they are here, Japanese doctors, they're very poor in English speaking. So this is one of the, great opportunities for foreigners, of course, like Indians. I mean, yeah. So, and the second one is, well, not only that, see, for a root canal in Japan, for one root canal, it takes around in Indian rupees 80 to 90,000 rupees. It's like total expenditure, all the visits, and maybe it goes sometimes more than a lakh. This data is also like, I haven't been to a dental doctor for many years now, but I know this data is like 6-7 years ago. I heard that, oh, sorry, wait, I didn't convert. Okay, it takes 2 lakh rupees minimum. Sorry, I was thinking other currency in my mind. We are talking about rupees. So more than 2 lakh rupees for one root canal. So also, listening to Anil, I mean, I understood that there's a lot of materials needed. So that industry is also there. So if Indian companies, especially startups, if they could contribute to that industry, like material supply industry, something like that. Because if you want to have a dental clinic in Japan, there are 2 major requirements and 2 most difficult requirements, you can say. Not impossible, but difficult. Like you need to know Japanese language, unless you are focusing only for the foreigners. And even if you focus on foreigners, still you need to clear one national exam by the Japanese government. Then only like you'll get a license to work in Japan. Yeah, to practice in Japan, yes. So, but I think this one, the industry, not in the clinic thing, I mean, not directly dealing with the patients, but if you could contribute in the industry around it, like supply of, whatever material is used there, I think that's a great opportunity. And well, since I am the secretary of the Indian Chamber of Commerce Japan, it's also called ICCJ. This was established in 1937. And this is the only Indian chamber, I mean, which is recognized by the Ministry of Industries. So, I mean, we get many, what do you say, requests and emails from many Indian cities that they want to establish their business in India, in Japan. What are the requirements? And we always have this orientation kind of, sessions. So as Anil said, if anyone is interested in this, in the business in Japan, you can always contact Anil, and I'm always there to guide you on the procedures. So, well, I think these are inputs from my side. And if there's anything you want to know, well, of course, I'm here.
Yeah.
Okay. Thank you very much, Anil. And thanks
you.
for other
Thank you.
participants.
It's our pleasure you are here. The thing is, regarding Japan and all, every country has the same rule. Like whenever you want to settle down there as their practice to establish the dental clinic there, means even India also, if you want to practice, you have to clear that exam over there. The only problem with this European countries and Japan and all, language is the problem. That's why generally people flew to Australia, UK, and US where English is there. Okay, so the beautiful countries are there. Like you can go to Spain, Japan, Germany, Japan. But the thing, only problem comes because that language is not that easy also.
Yeah, true.
It's
I
not
agree.
something like okay. So that's the hurdle over there. So
Yeah.
typical where we go, then this typical Malaysian countries and Mauritius is there. You have this Dubai, all the Gulf countries are there where English,
But
Hindi
Anil,
works over there.
recently, see, there are many examinations which are also being conducted in English.
Okay.
I don't know about these medical, field, but for example, driving license test. Earlier, it was fully in Japanese. You need to write. I mean, there are like 30 lectures, theory classes you must attend, and also 30 driving, practical driving lessons you must undergo. And the exam used to be in Japanese fully. But in last few years, like 7-8 years ago, I mean, I took driving license in Japan, like say 10 years. It's almost 10 years now. So already the examination was in English. So I will find out if there is such an option there. But definitely, foreigners are increasing a lot, and I think it's a huge opportunity. But as you said, it's in every country. But I will find out and I will let you know.
Yeah, thank you. End of the day, he has to practice there means he must know in Japanese because clientele and all, it's not just passing and getting a job kind of a thing. It is the private practice means definitely clientele and then relations. This is everything will work only with Japan, with the language itself. Okay. So anyway, thank you very much. If anything is there, we'll definitely let you know. Anybody who is going to Japan is there always for your this thing. The great man for any help. Okay, and he hosted for this Olympic and Paralympic kind of a thing. The great experience he had with him when he came to India. The biggest advantage with the Chaitu is he's having one collaborative business in Hyderabad itself, that in our Balapur. Okay.
Yeah. So
So
I'll
he's
be there.
coordinating that some magnet.
Yeah.
I don't know what exactly it is, but some magnet related business is there.
Anil, I will be visiting Hyderabad in November for 3 weeks.
Yeah, you're most welcome. Thank you for your valuable.
Nice
here.
meeting you, Chaitanya. I mean, Anil, I've heard a lot of times actually.
Oh,
It's good
that's
to
very
meet
kind
you
of you.
today. Yeah, whenever you plan a tour or something, like always Anil used to tell, like, why don't we go to
Oh.
Japan? One of my friend is there, like he can take care of everything. Like, he'll show the
Of
places.
course. Whatever Anil says, everything is
yeah,
here.
yeah. We used to wonder like when that day will come, but most probably in the nearby future, like not even the future, like very nearby. This one, like we'll plan my day, and so that we
Please.
will all will come to Japan and meet you there also.
You're
So
most
nice meeting
welcome.
you. We'll keep on continuing our collaboration with you. Okay, so next week we'll all get back together, depending on the time and then depending on your availability. Okay, thank you, Anil. Thank you very much.
I'll thank you once again, you all. Thank you for giving me valuable this time and believing us and sitting with us. Thank you very much. So let us conclude over here.